Hi, I'm Dr. Andrea Trowers, and today we'll be injecting my fantastic physician's assistant, Ashley. So the areas that we're going to be concentrating on today is that we're going to be doing some Dysport, which I like because it gives you a very soft, natural look. We're going to be injecting her forehead, so just raise your eyebrows for me. Good, and then relax. So we're going to be softening the movement there, and then frown for me. We'll be softening here as well, and then smile. And then we'll be softening over here as well. We always want to leave just a little bit of movement in the area so that it looks natural and nobody knows you had anything done. The other thing that we'll also be doing is we'll be injecting a little bit in these etched in lines that she has right here. For that, it's not the same as the nasolabial folds, which are more of a depression that you need a thicker or more robust filler for. This is for fine detail work, and as my medical assistant Lauren says, it goes where no filler has gone before. So that's to get those little itty bitty fine lines that are right there. The other thing that we'll also be doing is using a little bit of one of the toxins to soften her gummy smile. So if you smile hard, you can see where her gums show. So we're actually going to be injecting a little bit here and here just to relax that muscle and drop down her smile line. So we're going to go ahead and get started. Okay, so we're going to go ahead and get started. We're going to start with these fine etched in lines over here. So I'm using Restylane Silk. We've already cleaned off the area, so you're going to just feel that little pinch there. And using this filler, it's very superficial. So in the very beginning, you can see these little minute bumps in the area, but those go down over the next week or two. And it's fine to massage them out yourself, actually. But it has to go very superficial to get that little fine crease that's in the skin. So I'm going to go ahead and finish this side, and then we'll show you after we finish both the right and the left side. So Ashley survived her injections. So we've completed injecting the little etched in lines that she had on either side of her mouth over here and here. You can see she has a little bit of pinpoint redness and a little bit of swelling, but that will all resolve. So we're going to go ahead now and do her Dysport as well as the Gummy Smile, and then we will be showing you her follow-up visit in 2 weeks. Thank you. Hi, I'm here with Ashley for her follow-up after getting her cosmetic treatments done. So I'm going to go over with you step by step so you can see the final results. So first of all, when you look, we did some Dysport in her forehead. So if you raise your eyebrows for me, you can see it that all of these lines have been significantly softened, but we still left her with a little arch to her eyebrow because you don't want to be completely frozen with these treatments. We also did the Dysport around her eyes. So I'm going to hold this up and then just turn towards me and then just smile hard. So you can see how also these lines around her eyes were significantly softened. We call it giving you the movie star smile, which we like. Also, what we did is we used some of the Restylane Silk, which is a filler, to soften these lines around her mouth. So you can see these little fine etched in lines have been significantly softened. This is the before, and then we have the live after here. And the great thing about these fillers is that they actually stimulate collagen growth. So over time, it actually continues to improve as long as you keep up with the treatments. And then part of the reason why we always have our patients come back for a follow-up appointment at 2 weeks is whether or not they need a little touch-up in the area. So Ashley actually has pretty strong frowning muscles. So we're actually going to do a little bit more here because she still has her frown is still pretty strong. And we're also going to do a little bit more in her gummy smile to continue to soften it. But what you can see when she smiles, because I actually injected her lines when she was smiling, you can see how this line here is significantly softened, as well as the lines tracing out here are significantly softened. So it's important really to see your face in activity as well as at rest so that we end up with the most perfect result. So if you have any questions, the information for the office will be on this video screen. Thank you.